Welcome to T's Voices, telling the stories of the people in our NHS community.
Hello everyone, and I'd like to welcome Alan Macdonald to the podcast to talk to us about the 10-year plan that was just dropped hot off the press.
Thank you very much. My name is Alan Macdonald. I'm the Group Chief AHP. As has just been stated, I just felt it was really important that we address the 10-year plan and think about the opportunities and the perfect timing, really, that gives us for showcasing our services at the moment. So the new model that is set out is called Fit for the Future, and it predicts and prevents ill health rather than diagnosing and treating. And I think there's some really unique opportunities for us as AHPs to come in and offer solution-focused healthcare. It's looking at narrowing health inequalities, and the areas that we live in and the areas that we serve in the Tees Valleys have a real challenge with health inequalities, and it's something that we really need to think about and address. And it's looking to do this in three very clear directives, and these are hospital services moving to neighbourhood services, analog to digital, to make the NHS the most AI-enabled care system in the world, and moving from a sickness to prevention bill. So I'm going to take you through three of those three areas and just talk about the principles and where I really feel we need to focus and think. So hospital community is the first outlined, and essentially the plan talks about moving hospital services to high streets into 6 day a week, 12-hour a day treatment centres, and it is named that rehab services where possible would be within them. To end fragmentation and to bring together patient care, and it has to be patient-centred care, and really to embody throughout preventative principles. And I think this is something we've been crying out for as AHPs for a long time. We've been talking about our worth in rehab, but we've actually been singing the song for a long time about prehab and what we can do, and there's some real opportunities here. We know that our systems are digital by default and that we actually need to look at where we can go. And since COVID, we've been doing lots of work around different shifts to digital. But we've had a bit of a stall from a monetary point of view of moving systems and seeing where we can go. And this sets out that patients should be treated at home where possible, in neighbourhood health centres when needed, and in hospital if absolutely necessary. So health spending needs to shift to accommodate that proportional investment, and there's a very clear outline that will shift within the next 3 to 4 years with the budget controls. And the AI will enable hospitals and services to be able to deliver much better and quicker hospital care. So thinking about that and thinking about that analog to digital opportunity that we've got, we've got an opportunity here to really improve access to the NHS app. The NHS app is utilised by a huge amount of our patients, and we already know that it's saved over £80 million from the use of not having paper and sending sending letters out. But actually, we need to be thinking as HPs, how do we use and develop the NHS app? What can we put on from a rehab tool? What can we put on from exercise prescription? What can we put on around tests that we do and what that means for patients around education? We need to think about AI through the NHS app and how we would have systems that patients can read education and not necessarily need to see a clinician, but would be able to self-manage. One of the comments within digital to analog, again, something that's quite hard-hitting, is a move from bricks to clicks. And I think it's quite a catchy one-liner, but actually what we need to be thinking of, why are we bringing patients in unnecessarily if things can be done from an AI way? We're also looking very much at a single patient record. There is a very clear mandate that by 2028, this work should be moving. And actually, how helpful would it be if wherever we were treating a patient in their journey, we had one record that could be utilised? So we're looking for front door to the entire service by 2028. We've got NHS advice, choose your provider, book and manage your meds, manage your long-term conditions, manage your children's health, leave feedback, leave monitoring, have a health store with all the education resources that we need, and to have an AI scribe for clinicians when writing notes, all to sit within an NHS app by 2028. So it's really a big challenge when we look through that. From a sickness to prevention point of view, the third large headline. So the government has made a commitment within the next 10 years to half the gap of life expectancy in the richest to the poorest areas, to really equal that up as much as possible. And that's really key when we look at the areas that we serve, when we have in the northeast some of the lowest life expectancies in the UK. There's a huge cross-society energy on prevention. It's looking to end obesity, to stop vapes and tobacco bills, and we'll have seen this week that at the end of June, disposable vapes have now been banned from shops, and that is hopefully with the main thought that 11 to 15-year-olds will stop vaping. Really alarming numbers in that the 11 to 15-year-olds in the last 12 months have more than doubled, and it's said that 1 in 3 or 1 in 4 11 to 15-year-olds vape. The incentive health reward scheme to promote healthier choices. Looking at alcohol, mental health increased services, which is really needed. And then also genomic population and health services and early identifying high risk. For me, I think there's a real opportunity here. One of the things within genomics and health population services is looking at wearables. And with wearables, what we're talking about there is your smartwatch. And actually, we really need to be thinking of prehab and rehab, of linking into how do we use things like a smartwatch or how do we use digital technology through an NHS app, that we can absolutely be showing patients how they stay healthy, using their heart rate monitoring, using their blood pressure, and actually thinking about exercise prescription and thinking about advice on diet that we can give through these types of models. And we're really going to find that. So this new model is going to flatten hierarchical structures. It's going to let services be closer to home. The main focus through this is that we're going to have earned autonomy. So there's going to be stepping in from the government when there's underperformance, but actually high-performing trusts, foundation trusts, are going to be rewarded with autonomy. And the way they're going to be rewarded is to reinvest their money into their own services. So again, for me, for AHPs, we need to have a loud, clear voice of how we can help neighbouring communities, how we can help the prevention bill, what we can do in AI, and what we need investment for. We're going to be expanding working with private providers, and that I think is something that people will be nervous about as we move forward, but we've got to think what is best for the patient and how do we do that in tandem collaboration. There's lots of positive models within that. Wes Streeting at NHS Confederation talked about an example of this where he talked about the possibility if eye tests could become more AI generated through Oculus or through different forms of AI. Could we actually be using high street opticians to be focusing on glaucoma work rather than patients coming into hospital to do that? And thinking of an example like that, there's probably lots of examples that you think of in your own service where you think, oh, actually, that might make sense, and we could maybe think of how we would do that. So for me, private providers doesn't necessarily mean your private physio down the road who would work with your NHS. I think what that means is we need to use private digital companies to enhance our services, and we need to show what we can do. There will be some opportunities where we're working with private clinicians as well, and we've got to drive that forwards. And the other thing that's really important and really powerful is actually patients are going to be asked for what they believe their outcomes are, and they're going to have a voice in whether trusts get paid or not. So they're going to be asked, should the trust get paid the full payment for the journey that you've gone through? Have you met your outreach outcomes? And we don't know the exact detail of it yet, but if the resounding pathway of that is no, we will be penalised. So therefore, outcomes are absolutely key in the new NHS plan. That communication with patients and making sure that patients are absolutely involved in their journey and feeling that they're having a positive patient experience is something that we really need to focus on. And we're great at thinking about our patients. We're great at thinking about how we would involve them. We're not always great at having them round the table and having them as an active solution focus to what our services need to be. So the NHS plan for us as AHPs will really push how we bring our patients in and how we make sure we build our services that are patient focused and outcome focused, because we need to be able to deliver outcome measures so that we get that payment to re-put money into our services and redistribute that funding into the areas that we feel locally are needed. Some really tough asks. We're asked to produce productivity by 2% year on year in the next 3 years. There is some commitment to allow staff development, to have reduced sickness in the NHS by having a better place to work, by developing advanced practice throughout all professions, by having more neighbourhood consultants, professions that are not medics. So for me, why are AHPs key to this? I think as you hear through what I've just said, there'll be some moments that have shocked you, that have raised your eyebrows. eyebrows. There'll be some moments that you think there's a lot of opportunity here. And I think as we digest and divulge that and think of where we're heading in the future, we're going to have lots of innovative ideas of where we go. And we're going to have lots of thoughtful engagement and implementation to really think about what's our research telling us. It's really important that we push the research bill at the moment. It's really important that we have staff undergoing NHIR projects, that we have staff doing their master's modules, their PhDs, that we're really thinking about our quality improvement and our service design models, and we're supporting one another and giving time through job plans in order to do that, because these are the types of things that are going to lend us the answers of the evidence base behind why we do what we do and why we take services to where we take them. But more importantly, we need to be open and honest with each other. We need to not be afraid to voice our ideas of how we think things might work. We're not going to get this right the first time, but we are going to have some absolute golden nuggets of ideas that we can pitch, that we can think of, and that we can take forward. And we need to support each other and be really valued with one another from different professions coming around the table, looking at the same end outcome for a patient to walk out of hospital, to stay at home, to be treated locally in the community by our services as an MDT, which can deliver the best care. For me, the real key message here, and the thing I really need people to work with us on and to come together with, is a culture. We need to have a culture across our organisation that's kind, that's civil, that's caring, that's listening, and that really wants the best, to put the patient in the centre for high quality care. And I think we do have that. I think in both organisations that are coming together as group, we've maybe had slightly different buzzwords or slightly different formats, and we know it takes a long time to come together as one culture. But for me, in the work we're doing as AHPs, it's really important that we realise early on we've got the same vision and we've got the same values, and therefore we can work together, however we come together in group. But there's lots of opportunity within the NHS plan for AHPs, and I'm really excited to go on that journey with you all. So thank you very much.
I'm very aware that me and you have sat silent throughout the whole of that podcast, but I'm going to be honest with you, that's because I was listening with fascination, and it's been really helpful to have you summon things up in a way that maybe is easier to digest before we dip into starting to read it. So I definitely now will go ahead and have a read of that. You've whetted my appetite, so thank you so much for that. That's been really, really insightful.
Yeah, it's great to have it summarised like that, rather than if you don't have time to read the whole document, you've got it summarised what it means for AHPs, and it's been delivered really well by Alan, so thank you very much for doing that.
Thank you again for joining us. Really appreciate you spending your time with us. Look after yourself.
And each other.
Thank you very much.
Thank you for joining us. Till next time, you've been listening to T's Voices.